Doctors of Reddit, what do patients do that annoy you? When they come up with these miraculous ways to lose weight fast or ways to keep looking young. Come to me and ask me what they could potentially have, and then interrupt me because their Google PhD knows better. According to my nurse girlfriend, when they bring their family member who has some medical training and that family member orders me around. When patients tell me I've got a really high pain threshold during the history and then act like they are being axe murdered when I take blood or put in an IV line. Med student, but usually something along the lines of, "Are you smoker?" Double quote. Nope. Have you ever smoked? Yes. How long were you smoking for? -2 packs a day for 50 years. When did you give up? Double quote. 3 days ago. My partner is a doctor. She had 2 answers. First, the doorknob comment, come for a 15-minute appointment. Spend 14 minutes talking about a mild cough. Then as she goes to leave the room, patient suddenly remembers, oh, errand my D is green and smells strange. Second, having to write medical certificates letter for employers that require them if someone takes a day off because they're sick. Waste of everyone's time. Patient stated he has a cold. Examined and determined that patient does indeed have a cold. Thanks for wasting my time. Animal doctor here. I hate when clients bring in their pets for a sick exam and decline all diagnostics and treatments. It's one thing if they're financially in a rough spot, I try to help them out as much as I can. But it's another when they say things like I just don't believe in medicine or I think I can fix this with coconut oil, turmeric, essential oils, crystals, and I don't trust any of your advice. I feel like I've done nothing to help their little friend and I worry about their pet all day. Bonus anger when they want to pay for a toenail trim for $20 and the medicine they've declined is cheaper than that. I've even gotten those when I try to give them a free trim so that I could send home meds. Non-compliance. Oh, you're not feeling any better after the antibiotics? I didn't take them. When they come in with non-evidence-based, unproven and sometimes dangerous recommendations from their naturopath's egg, broccoli juice cures cancer. Not a DR, but when I'm doing history intake, when the patient says it should be in the chart for basic screening questions like do you have a family history of cancer? Physical therapist here, when this conversation happens. Patient, you made my back pain worse. Me, oh no. Which home exercise aggravates your pain? Patient, I didn't do them. Me, okay. Then what did make your back pain worse? Patient, I have no idea. Me, what did you do yesterday? Patient, well, I felt better after you examined me. So I played golf for 6 hours yesterday, went to roller derby practice, helped 3 friends move, ran a half marathon with no training. And now I feel worse. Me, Fasipum. I'd say the general belief many patients have nowadays that pain is never okay. That being sick and feeling like it while your body heals is unacceptable. You broke your ankle. I can do lots of things to help you heal and be in less pain. But it's going to hurt. Being pain-free is impossible. You have the flu? You're going to feel like complete ass for 5-7 days. Feverish, achy, weak, coughing. Frankly, unless you're seriously ill, you shouldn't be contaminating your community and my waiting room. Go to bed. Take Tylenol or ibuprofen, fluids, and wait. It is not their fault. But where I came from we have to see 40-60 patients in an afternoon. Time is of the essence and we have nearly 15 minutes to interview. Figure out what they have and tell them what can be done. Because of the time frame. During the interview we need objective answers. Something patients avoid like hell. We ask when the pain started and they say, well, I was at Mary's wedding when it started. Thinking, who's Mary? When was it? 28th day. Thinking, of which month? I have several other patients and don't want to be rude with this one, but I need answers. Some of my absolute favorite things to hear as a GP. No, you see, I know my body. Before diagnosing themselves with the most ridiculously far-fetched affliction they managed to Google, I have a high pain threshold. But, before fainting from a hypodermic needle prick, I never, ever run a fever. Or the opposite. No really. 36.5 C is a very high fever for me. You don't understand. I need this cold to go away as quick as possible. That's why I really do need antibiotics. Oh, I'm sorry. That's alright then, my bad. Telephone call at 2:30 in the morning. I can't sleep. Well, neither can I now. And yes, this actually happens. My personal favorite are patients with lower back pain, demanding investigations for their kidney pain. Must be awesome to be able to diagnose yourself. What do you even need me for? And just for its and giggles. Here's my real absolute favorite thing a patient has ever told me. My date of birth? How should I know? I never went to school. Edited for clarity. Try to stab me in the heart with a silver rod. Also feed me garlic and hold 2 pieces of wood together trying to make a cross. Not showing up on time. My schedule is usually tight, and if some wheel throws it off, it doesn't just mess up my day, they are impinging on someone else's time. I just find it incredibly rude. I understand it happens sometimes, and people can't help it, but some people are just chronically late, for no real reason. The eternal paradox of demanding all of the physician's time for themselves while expecting him to tend to others quickly. Did you waste 15 minutes of your consult shuffling papers or going on about unrelated stuff? Take a look at the next person going in as you walk out of the consultory. That's also his/her time you were wasting. What's really frustrating in this thread is that I understand why some of those things would annoy doctors, but it's also turning people away. The best would be to have, like in the UK, a helpline to explain what's going on that would help you decide what to do. That way you don't uselessly clog services while still talking to a professional. Belittling their GP's family doctors. I'm not a GP, but they don't just deal with colds and gastro. If the GP misses your DVT, you could die. If the GP misses your bowel cancer, you could die. If the GP doesn't treat you for a community-acquired pneumonia, you could die. If the GP doesn't realize that your headache is actually meningitis, you could die or be left with brain damage. And what is there to belittle? GPs in Australia can make at least $35 for 2 minutes of work. That's all it takes to sort out a sick note or a flu shot. Not a doctor for the sake this post, but pharmacist chiming in. Patient, I have a 2-year-old with a runny nose, and I found this homeopathic remedy that doesn't actually have any medicine in it. Is this a good choice? Me, well, there's no evidence to suggest that this product is effective. But this Claritin Zyrtec is not only cheaper, it has real medicine in it that has been clinically proven to help manage allergy type symptoms including runny nose, and is labeled for use in a child this young. Patient, no thanks. I'll just give this other crap, after wasting 10 minutes of your valuable time, against your professional advice. Not a doctor, but I work as a technician for a dentist. Whenever a patient says I'm planning to go to insert a place ridiculously far and permanent trip out of the country in 2 days, please get this done by then. When that happens, you're basically asking for a job. There's a good chance whatever work you're getting won't fit properly, or may break in a few months. Besides the obvious rush mentality that gives the result a risky conclusion, it's also because you give very little option to the dentist to do try-in appointments. The try-in phase is very important and a good investment to ensure that your restoration will turn out good. To compare, what you're basically doing when you ask for something in 2 days is you're completely skipping the test drive and just buying the car off of what you know from specs and then expecting to be satisfied with it. Be kind and give your dentists and technicians a good minimum 4-5 working days for low unit jobs. That is, single crown, denture flipper, and 8-12 working days for high unit jobs, full mouth restorations, multi-unit crowns and bridges, implant work, for each part of the phase. For some ducking reason, school teachers always think that they know something about medicine when they know duck all. Go away. Biomedical engineer and very sick individual here. For me, not wear their goddamn braces. For doctors I've spoken to, not take their goddamn pills. When the question asks a specific group, example, doctor engineer, and you get a million not a doctor engineer people chiming in. I am a doc. The worst is the patient that is allergic to everything except the medicine that they want, which is dilaudid most of the time. I'm a dentist. And we know most patients are pretty high anxiety and everybody deals with that in their own ways. Sometimes it's talking a lot. Sometimes it's wincing even though nothing hurts. Sometimes it's even being mean to me or my staff. We get it. And that is why we spend time before any procedures explaining things and talking about anything you want. But what really annoys me is once we get going, I just need you to sit still and keep your mouth wide open. I am performing microsurgery on your tooth with a very sharp drill that spins at 300,000 revolutions per minute and I need to make cuts to tolerances of 1/10 of a millimeter in dark confined spaces in the back of your mouth. I'm sorry you don't like the feeling of your own saliva pooling in your mouth, but I just need you to suck it up for 30 seconds so I can do a good job and we won't have to redo this in 6 months.